What's up, guys, and welcome back to Book of Entertainment. So, ENCA is actually reporting, that KZN police officers they actually shot at some foreigners who were demanding a health care at Addington Hospital. But the real story is these foreigners, they were being denied health care at Addington Hospital in KZN, right? And then they were trying to fight for access to the hospital. So, in fighting for access to get into the hospital, that's when they then said they've been attacked, a match member. Then the police, in dispersing these foreigners, that's when they then shooting. I'm sure you know those rubber bullets. It's not like live bullets, but those kind of rubber bullets, just to maintain control. So that is what was happening. It was that is what the police were doing just to maintain control. So this is what is being reported by ENCA, and it happened in KwaZulu-Natal. And the issue, is that the public hospitals in themselves, they are said to be overcrowded, like with so many people. So some groups, like Operation Dudula, are saying it's actually foreigners who are causing this overcrowding at these public hospitals, and they are getting this medical aid for free, medical aid, exactly, medical access for free, and they are denying the foreigners for that. But another issue also at the same time is that there are also some people, who come from places like Zimbabwe, going to South Africa just for medical access only. Others go there just to be able to get, what is it called? Like when you have a pregnant woman and who wants to give birth to the child. So some of them, they go to South Africa because they know that in South Africa they can get that for free, but in Zimbabwe you have to pay. So you can see now that there will be a flock of people from areas like Zimbabwe to South Africa, which then causes congestion at hospitals in South Africa. So that is the main root cause of conflict in South Africa. There, in that there is a lot of people. Some beds are the beds where the patients have to be sleeping, they'll be all full, and others would be having nowhere to be sleeping on those beds. And there is, I think last month, there were these doctors that were actually marching and sort of protesting and saying, we want jobs, we want to be given jobs. So you can see that the entire situation is kind of ironic at the same time, in that you have doctors that are demanding jobs, and you have patients that are requiring access for medical services. So the solution that can actually be brought in, is maybe to redirect the funds of the national budget, and make sure that most of these doctors, they are employed so that they can give medical access, to everybody, because it's something important. It's a basic human right, to be getting the medical treatment. So it's a solution that can definitely alleviate the issues and challenges that are faced at those public hospitals. So that is what is happening. I'll catch you guys on the next one.